We are back on the town hall with a concern that we got from several viewers last month regarding Medicare patients and those on Advantage plans not being able to get free COVID tests at the pharmacy like most people who have private insurance. This is what a viewer named Patty told us. She said, quote, "As most of us on Medicare are over 65 and in the high-risk COVID category, I was astounded that we are not part of this plan." Well, there's good news for Patty and everybody else. That's now changing. The federal government announced today that Medicare beneficiaries will be able to get those free at-home tests. The change includes those on Advantage plans, and it will happen sometime in the spring, though we don't have an exact date yet. Now, this is potentially big news, though, for the more than 63 million people on Medicare, especially when you consider almost 90% of them are at least 65 years old. As Patty pointed out, they are more at risk for severe complications from COVID than the general population. So how will the free tests work? Well, we don't have all the specifics yet, but Dr. Jennifer Walsh, Associate Medical Director at Independent Health, told us that there are some hints out there.
I think our best clue is how other programs are already working. So I expect that it'll work similar to what is set up for commercial and self-funded plans, but that is not established yet. We do know from some questions that have been asked to CMS that it will be a program where Medicare members will have to pick up their tests from a pharmacy or such a provider and will be covered from that point.
And again, it likely won't be until March or April when this gets started. Until then, remember that you can still order those free at-home tests from the government at covidtests.gov. You can get 4 of them per household. The U.S. Postal Service delivers them. There are also a lot of free in-person testing sites all over Western New York.